Hello, it's Dr. Rhonda Johnson. Today is Wednesday, June 14th, 2023, and today I'm discussing LGBTQIA health. Well, we all know that June is Pride Month, and this is a time of celebration for members of the lesbian, gay, bisexual, transgender, queer, questioning, intersex, asexual, pansexual, and allies community, not only here in the United States, but around the world. Now, I'm a firm believer that healthcare is a basic human right. And unfortunately, LGBTQIA individuals continue to face significant barriers to accessing healthcare services. This can include discrimination that they may encounter from medical providers, as well as a barrage of laws that are being passed in some states that allow healthcare providers to refuse to provide certain services, including gender-affirming health care or fertility treatments to their LGBTQIA patients because doing so would violate their so-called religious rights. I think this is a dangerous trend because it could prevent a person from getting needed care. Now, some of these anti-LGBTQIA policies are directed at health care. Others address education and all aspects of freedom, from mandating teachers to report pronoun and name changes, to banning gender-affirming care, to banning inclusive books, and even preventing and prohibiting public accommodations. Folks, I find these actions so very troubling. Now, back to some health issues that LGBTQIA patients may face, and this is not meant to be comprehensive. Well, first is coming out to your healthcare provider. Some patients continue in this day to not feel safe or welcome, and it is important to find healthcare providers who are welcoming, because coming out is an important part of staying healthy. And then there's the issue about preventive care. You know, all people need comprehensive primary health care. This includes preventive screenings for common medical conditions, cancer screenings, age-appropriate assessments and immunizations, and gender identity and sexual orientation should not be barriers to getting this comprehensive primary care. And then there's behavioral health services. Research has shown that members of the LGBTQIA plus community are at higher risk for mental health conditions, particularly depression and anxiety. And we know that when people are stressed, anxious, depressed, or overwhelmed, they need access to healthcare providers who understand the issues that they face. So navigating the healthcare system is, unfortunately, in my opinion, very hard. Even though I'm a physician, I've had to navigate the healthcare system too, so I understand. So if you are a member of this community, my question is, how do you navigate the healthcare system? Have you found it difficult, or what resources have you utilized to help you to find providers that you feel that you are comfortable with and trust? Now, there is one website that I'd like to direct attention to, and I'm not affiliated with this organization, and I know there are other resources out there, but this is one I'm just highlighting. It's called outcarehealth.org. It's a website, and it offers an international directory that recognizes LGBTQ plus affirming providers. There's also the Gay and Lesbian Medical Association here in the United States. So please know that although I have no affiliations with these organizations, I found them helpful as a consumer of healthcare information. Now, you may know of other resources. Please feel free to comment, to share, because I'm personally all about helping people access healthcare, no matter who they are, no matter who they love, no matter how they identify. So that is my message today. As always, I hope you will take care and be well.